Hello everyone, my name is Dr. Shahriar. I hope so all of you are doing well. Today we're going to talk about the Plab 1 exam. Often I got a question from the doctors that how to prepare for Plab 1. So I'm going to tell you in this video how to take a quick preparation for Plab 1 in just 3 months. By the way, this is Dr. Shahriar. I'm a career counselor and an AMC and Plab tutor. Already I'm tutoring almost doctors of 40 countries actually, so we're here to help you. And about Plab 1, the first barrier that comes is an English test. So you can take the IELTS and the OET. For that one you can see our another video on English test, so I hope so you will get benefit from that one. I'll share the link in the description. And about the preparation of Plab 1, after clearing the English test and the EPIC verification and the GMC account you created, then you are up to the preparation, which we are going to tell here right now. So for the Plab 1 journey, which is started with some of the popular materials, the things are changing, the new materials are coming. Currently some of the popular and the trending materials is Plab 1 case, Plabable, the Oxford being the universal, and the other things just keep rotating. Even Plabverse, there's another material that came up. Now the main thing is to strengthening your the core thing. I would differentiate in that way. One is the core and one is the tricky part of the exam. Though you have to make sure that you know which part you belong to. Some doctor might not be that serious during their med school life. So that you need to strengthen your core. We have some courses to strengthen your core in that case, but some are very spontaneous during their medical life and the things they just came out. They also are in touch with the books all the time, so for them it's just a 3 or 4 months you should take and just quickly appear in the exam. For them, those have some gaps. They might not be that serious in the med school, and certainly some doctors are over serious, they want to pass in one go. So for them we have certain courses which includes the theory, question solving, and also the recall actually, but it's not recommended for everyone. If it's possible, Plab is not considered as tough as USMLE and the AMC exam. Personally, it's my personal prediction. I've seen all these 3 exams very closely actually, so as an expert opinion I can tell you that one. And about Plab preparation, that start with Oxford handbook being the number 1, that will cover your medicine, but it's not like that every line to line. It has to be a specific way, like initial test, best test, next step of management. Alright, so this is how initial treatment, best treatment, some cases very specific investigation, very ethical new questions. They also they like to test. Some of the genetic questions are also increasing. So this particular things you really need to keep eye on. You need to get the updates actually. So for that there are some forums like Plab forum, Shahriar's Plab 1 and 2 guideline forums. Good thing about these groups, or the beauty of these groups, all the materials are given. Alright, so those want to take preparation, you can start your journey with Shahriar's Plab 1 and 2 guideline. All materials are given free. Those things they have some gap, they need some help. Some want mock test and other materials, extra preparation on video classes, they can go with some of the Plab preparation course material and the core videos actually. Alright, now coming to that one, start your preparation with the basic medicine, and the most important book, there's Oxford Handbook of Medicine. There is Oxford Handbook of Specialty, but very specific things required from that one. Like it's not, I don't have that time to describe those things. What are the additional things required from the Oxford specialty. But the main books are the Oxford. Then for the surgery, Oxford Handbook of Surgery, or you can also utilize your own note, that's also fine. The most of the doctors that came from the background of Bangladesh, India, Pakistan, even some studied in China, most of the cases I have seen in my 10 years of career of teaching, that the psychiatry is never been good actually. There can be exception with some students, but I would say the 90 to 95% the psychiatry is not up to this level actually, so you have to match the level now. So Kaplan Psychiatry can be a very good book, but it's not about only Kaplan. You need to know what are the specific things that comes in the exam. Like previously in MBBS level, you know the SSRI things only, but now you have not only you have to read the SSRI classification, there are each every side effect, each every drug interaction. These are the things you separately. Like example, SSRI is one of the drug that might cause, some of the insomnia things, some of the SSRIs. In that case, a person who is coming to you and the person is already having insomnia problem and plus the person is having depression, can you give SSRI? The answer is no. Then what? Then you give an SNRI, that is the mitrazepine. So these are the tricky things which you need to figure out for this exam. For that, what to do, the question banks and the things and various courses are there, you can take help from them. I'm telling you again, it's not a very tough exam. So you just need to keep eye on and study regularly. If it's planning for 3 months, you appear in 3 months. If you want to appear in 6 months, then it's 6 months. So make a goal, make a schedule, and just go for the exam. Alright, this is how we can finish things well. So medicine, surgery, gynae, obs, you can take any of the gynae books which you studied in the MBBS, and also you can take help from those Plab 1 keys, Plabable, those things would be enough actually. In our center we provide some separate notes for the gynae and obs. We believe that Oxford is not well written for the gynae obs actually. And for ethical things, you really need to keep eye on lot of questions actually, because from ethics so many questions comes nowadays, so you really need to keep eye on that one too actually. So psychiatry, ethics, gynae obs, surgery we talked about, the medicine we talked about, and yeah, so these are the things. And finally the pediatric things you can check from the, again, Plab 1 case, Plabable, all these things. And you can also take some help from the basic books like pediatric Kaplan, you can take help. That will be fine in that case. No need to do the very big book. Some might give you idea, Gray's Anatomy, Nelson's Pediatrics, no need. Okay guys, so you will be able to finish the exam in time. And in another video I will be talking about if you were a graduated from China, Russia, Ukraine and some of the countries, say you're an Indian doctor or Bangladeshi doctor, Pakistani doctor, you graduated from some other country, can you bypass your own country foreign license exam and can appear in Plab exam? So wait for that video. I will try to help you. Is it possible or not? I will try to discuss in another video, because that question we got so often actually. So I hope so these things were helpful. I'll make another video with the demonstration with the books separately for the Plab. That would be a good idea, and how to study few of the things I will tell you about the more process on that one. Till then, it's bye bye. This is Dr. Shahriar. Thank you so much. Have a great day.